Well, here with Doctor Vik Mehta from the Elkhart Clinic, who specializes in family practice. Vik, thanks so much for joining us here.
Good morning.
I think a lot of people are wondering why we're doing this outside, and I think our company is following suit that a lot of companies are doing these days, limiting contact indoors. Right. And this is your specialty, is illnesses and seeing people. Does that indoor contact change when you go outside?
It doesn't necessarily change, but the distance around other people changes. It's the same reason that we get more colds in the winter, right? We're all inside, we're all together, we're all closer to each other, touching surfaces, touching other people, closer to people that are coughing, things like that. So being indoor limits your distance from other people.
The flu has been around, strains of it have been around for years. Right. This is just starting, and so a lot of the unknown is still out there, and that's why schools are canceling, tournaments are canceling, sports are canceling. In your opinion, is this just starting? How much longer are we going to keep pressing like we have been to cancel events?
So I think right now we're getting so much information so fast that we don't really know where we are. We don't know if we're in a containment stage or if we're in it's already here and it's going to spread. What are we going to do about that? So we're doing the best we can to make sure we're trying to contain things. That's why you see limitations on how many people can be in a certain area in a certain place at a certain time, those kinds of things. Just trying to, if we're in that first stage, limiting how it's spreading. Unfortunately, if it's already here and it's already in the area, we're going to have to figure out what are we going to do with those patients. Hopefully slowing it down will let us increase our treatment rates and get people into the hospital at the right time and not overload our hospitals all at the same time. So we got to figure out what stage we're in, I think, right now.
Well, and a lot of people are concerned maybe there's not enough testing here or we don't have enough testing kits. Where is the medical community here in South Bend, Michiana, Elkhart with that?
Right. So there is a lot of frustration with getting testing. The recommendations right now are to call your doctor's office or call your local ER before going there, and they basically will do a triage with you. Once they figure out that you are an appropriate candidate for testing, they will send you to an appropriate testing site, which they are in the area.
When we're talking about, washing hands and sanitizing, and are we doing enough to prevent it at home?
If we're doing those things, we're doing enough. If we're not doing those things, we're not. This is a respiratory transmission, so it's respiratory droplets, it's coughing, it's things in saliva, things like that are being transmitted. It stays on surfaces for a decent amount of time, so if those surfaces have the virus on it and you touch one of those surfaces, you could potentially get that. That's where this hand-to-mouth face thing is coming from. It's, if you touch a surface, it's potentially on your hand, and then you touch your face and your mouth, and then you're getting that respiratory droplet, and you're basically giving it to yourself. So hand washing after touching frequently touched surfaces, washing frequently touched surfaces, all those things are really helpful.
What is the incubation period? They were saying 2 to 10 days.
So the best guess right now is about 5 days of no symptoms where you could be a carrier. So you or I could be a carrier right now and not know that we're sick. I think the other problem is in younger, healthier people, they're not getting that sick. So they could call it a common cold, they could call it a little bit of a flu and still go around and do all these other things. The problem is that they may infect an elder person or someone that's already got a heart disease or diabetes, and those people tend to respond a lot worse. So, limiting social gatherings where, it's just young people and no big deal if they get sick. It is a big deal if they go home to someone that's got heart disease or someone in the area has diabetes, and that's where that all comes into play.
Right, and I'm just going to be honest with you. I was scheduled to head home next week to see my parents in California, and that's canceled. My father is 80 years old almost, and for me to get sick would be a different situation than for if he was to get sick.
Absolutely. So trying to prevent that is really what you're trying to do. And these are, they're inconveniences for a lot of people, and we have to just kind of think of the greater good and try and, do what we can to prevent it from breaking out.
In terms of our daily lives, it's changed already. What can we do? What resources can we go to, can we turn to get more information about the virus and the spread of the virus?
Right now, I've been looking a lot at the CDC websites and just trying to get the best information I can from them. They are the best resource. And, you know, there's other ones out there, but that's the one I rely on the most.
Dr. Vik Mehta joining us, the Elkhart Clinic here. More information can be found, too, on our website at abc57.com.